are you guys on mute? Just want to make sure that you're still with us.
Yes, we're here. Do you want me to go ahead?
Please.
Okay. Thank you. Good morning, everyone. Again, this is Sarah Johnson with Access. We just wanted to do a overview to just kind of level set sort of how we arrived at today and some of the things that Access is doing and how we're utilizing EVV in our program. So beginning with the first slide, so level setting for everyone, what is electronic visit verification, or EVV for short? It's a federal mandate that we electronically verify service delivery for two types of services, personal care and home health services. And in verifying service delivery, we're required to verify the service that was performed, the individual receiving and providing the service, the date and time the service begins and ends, and then the location of the service. And when we talk about the scope of these services, it's important to note that these services span across all lines of business for Access, whether that be our Access Complete Care contracts, regional behavioral health authorities, and our Arizona long-term care system. Just want to note that we are implementing EVV for both personal care and home health services simultaneously, and we are planning on implementing EVV within the first half of 2020. I also want to note that in November, we are going to be requesting an extension for our timeline for compliance. The current timeline is January 1st, 2020. We'll be asking CMS, the Centers for Medicare and Medicaid Services, for an extension in November, and we will be posting that request online, as well as posting an updated timeline. So stay tuned for more information on timeline for implementation. So how has Access approached EVV? Go to the next slide. We are using EVV as an Access to Care initiative. We want to help to make sure that Access members get the services they need and when they need them. So obviously it's important for our state to comply with the mandate to make sure we get the federal match for these services, but also we're using this as a way to make sure that members are getting what they need. So we are also focusing very heavily on supporting members and their families and being responsive to those needs, particularly those that we heard during our public comment period. So one of the things is we want to make sure that when we're that we have flexible options that supports our members to maintain their lifestyle, whether they receive services primarily in their home or out in the community. We want to make sure that the device options and the way the system functions support those lifestyles. We also want to make sure that we have tools to help support members to manage their care, including scheduling and monitoring service hours. And lastly, we want to offer choice when it comes to the device options that are utilized to verify service delivery. Various individuals may have different preferences, and so we want to acknowledge and accommodate those preferences. Access has selected Sandata to be our state vendor. That means Access providers can use the Sandata system through funding that's provided by Access. We're funding the development and the initial implementation of the statewide EVV system. We are going to consider additional funding options and funding models that's most cost effective to the state, while also making sure that we maintain our goal of cost neutrality for providers. Next slide. Again, in response to our stakeholder community and to our providers, and acknowledging providers to make various business decisions and have flexibility to do so, we have elected to use an open vendor model system. So providers have the choice to use our state selected vendor, and providers can either use an alternate vendor that they currently use, or make a choice in the future to use a different vendor. We acknowledge that some of you as providers who have existing systems with another vendor, or maybe it's a homegrown product that you've created, if you're using an alternate vendor, they may have an existing relationship with Sandata in another state and receive certification as an alternate vendor. There will be a unique Arizona specific certification process to make sure that the alternate EVV vendors meet Arizona-specific requirements, and we are prioritizing the development of those requirements as we speak, and we're hoping to get those out to you in the near future. Again, just like this webinar, to help inform your business decisions around what choices you want to make with EVV. We wanted to go over quickly the provider types, the services and places of service that require EVV. And you have to look at these somewhat in combination with each other. So to know whether or not you as a provider are subject to EVV, first you have to acknowledge and identify if your provider type, access provider type, is listed on this list here. And here's the exhaustive list of providers who have to comply. Regarding service codes, so you look at if the answer is yes to this to one of those provider types, then you look at the following service codes and determine whether or not you provide these services. One of the things that I want to highlight and clarify is that you see some therapies listed here. These are therapies that are specific to a home health setting, so specifically to under the auspices of a home health agency and provided through a home health agency. They are not just these therapy services provided in general. So it's a very specific niche of therapy services. So if you're one of the provider types and then you provide one of these services, then you go to look at the places of service and determine, which is the next slide, please, and determine whether or not you provide those services in these places of service using these place of service codes. And if the answer is yes to something on all three of those slides, then EVV is something that you are required to participate in. Access to care. We wanted to highlight for you that what you're going to have demoed today is Sandata's basic framework for their system. There are a number of things that we're working on with Sandata currently to configure the system to meet our access to care requirements, or rather our goals around access to care. So I'm just going to kind of walk through a little bit some of the priorities. You won't see all of this demo today, but this is certainly a high-level overview of how the system will work for us moving forward. We are going to require that all services have an authorization from the health plan. Currently, some of these services are prior authorized and some are not. So we are still working through this with the health plans and our provider advisory council to consider how we might accomplish this. But this is important for us to measure some of the access to care monitoring and tracking that we want to. So our considerations in that process are to make sure that we're conscious of provider burden and trying to keep them at a minimum. And also, we also don't want to cause any delays in the service delivery process. But ultimately, we want there to be an authorization that's sent to Sandata. Based upon that authorization in the system, providers will enter a plan of care, including what services are going to be provided and what specific tasks or goals will be performed, and goals will be specific to the habilitation and skills training and development services. Then providers will enter a contingency plan. Those of you who are Altex providers are very familiar with this. The EVV system will replace gap reporting. But today, contingency planning is one of the things that Sandata will be configuring for us. So you won't see that demo today, but that is something we're working on and including in the final product. Providers will enter the schedule for the direct care workers based upon the plan of care. And then next slide, please. In the event that care is not initiated when it is supposed to be and scheduled, the system will generate alerts at 15-minute and 30-minute intervals. The first alert will go to the individual that the provider will identify at the provider level to receive that first alert. And if there is if there hasn't been anything that has occurred in the system to initiate that service visit, or a service visit hasn't been rescheduled, then a second alert will go out to someone over that person, again, identified by the provider agency, to make sure that we're mitigating gaps in care. Member and designee verification, so members and or someone designated by the member or guardian will be required to verify service delivery at the end of the visit. Ideally, that will take place at the point of care, but could also take place at a time after that. This is something that Sandata will be configuring for us, and this information will be entered into the system so those individuals can verify later. In some way, one way to do that would be through having access to the portal and being able to sign off and verify service delivery at a later date if it doesn't happen at the point of care. So additional information on the AHCCCS website can be found, there's additional information on the AHCCCS website. I would encourage you to take a look at that information on a regular basis. We are updating it at least monthly, if not more often. There is specific information for members and providers. I do see that there are some questions coming in regarding some of the specific provider types and things like that, whether or not EVV is subject to those. And I would encourage those providers to take a look at the FAQ document on the website. Some of those questions are answered specifically around IDLA homes and so forth. So we would encourage you to take a look at that. You're always, our contact information, an EVV website or email address is on that website, and you can always submit your questions to us after today's webinar. But we do want to make sure that, most importantly, the most important action is for you to sign up for the Constant Contact email list. Anytime we make an update to the website, we are notifying people through that venue. So it's very important that you do that, and you can do it under the Stay Informed tab. And we'll review this information at the end of the webinar as well. But it's really critical, particularly at this juncture, so that we can get direct communication from us on any recent events or anything that we need to communicate to you regarding the next steps. And that concludes our program overview. And I'm going to toss it back over to the folks at Sandata.
All right, thank you, Dara. So like we mentioned earlier at the beginning, so all attendees have been muted, so don't unmute your line. If you do have to leave briefly, do not put the call on hold, otherwise we'll hear some music. And this webinar is being recorded and will be made available on the AHCCCS EVV website. All right. Hello, everybody. My name is Sean Dunham, and I am the Sandata EVV product manager. I've been with Sandata for about 1.5 years and in the healthcare technology space for over 2 decades. It's great to be talking to you all today, and I want to thank you for the opportunity to show you the Sandata EVV solutions. So who is Sandata? We are the leader in home care technology with over 40 years of experience. We deliver a fully integrated solution to bring together payers, providers, and participants in one product suite. Our solution is fully Americans with Disabilities Act or ADA compliant. We serve over 500,000 members a day, which is about 200,000 homes, and we are the only EVV solution with a Centers for Medicare or Medicaid Services, known as CMS, certification. We have the largest experience in scale with 24 Medicaid agencies and managed care organizations, or MCOs. You can see on this slide our key payer relationships and how we are partners with some of the largest providers in the country, including AHCCCS. And like Dana mentioned, what we bring to the table first and foremost is Cures Act compliance. And we bring you the value you need not only to collect this information, but improve participant satisfaction, decrease cost, and improve the care monitoring, collecting the right information with the right solution. How does Sandata and the state provide the value that you need? We have several tools to help you. The first is the Sandata EVV solution, which is the provider portal. Create schedules, verify visits, run reports, view plans of care, and monitor the direct care workers, or DCWs. The DCWs can then use the Sandata Mobile Connect application, which is HIPAA compliant and makes the process of collecting the Cures Act information easy and efficient. An alternative is using a telephone to conduct telephonic visit verification, or TVV, and collect the visit data and member confirmations. Another solution is the fixed visit verification, or FVV. This is a device in the location that assists where there is poor cellular service or a landline is unavailable. I'm especially excited to demo the Sandata scheduling and billing modules for you today. Schedule single and recurring visits for members with DCWs. Use the billing module to create invoices and then submit the claims you just created in the application. And I want to point out that scheduling is required for this program, and while billing is optional, I think you will see the ease of use if you choose to use Sandata EVV as your billing solution. The way we bring everything together for your program is with the aggregator application. This application can receive all state-approved EVV provider system information, and so that you can view all the data in one solution. Okay, so I want to give a little more detail about our visit capture technologies. First is the preferred solution, Sandata Mobile Connect, or SMC. Not only does it collect the data needed to be Cures compliant, but it is easy, fast, and accurate. It supports multiple languages for both the member and the DCW, and it can operate without being on a network in a disconnected mode. Once there is a signal, the data will be sent to the main application. And there are two alternative methods of collecting the visit data for the DCW. The first is the telephonic visit verification, or TVV. Like SMC, it is also available in multiple languages and can help those who do not have smartphones. The second alternative for visit capture is what I mentioned earlier, fixed visit verification. It allows you to generate a number from a device and use that number to collect visit data by using telephonic visit verification once a phone is available. It will also be critical for those who are going to need to use manual entry paper timesheets. The device numbers will make sure the call-in and call-out information is accurate. So to recap, it's important that the solution you need does not only what is required, but also meets the needs of your program. In order to do that, our Sandata EVV solution gets the point of care information for you, and then makes sure you have the other important data points covered, like a member's plan of care, the ability to schedule visits, reporting, and not only that, but the program information is exactly as you need it. So how do we do that? We work with the state to create a set of business rules, and then we use that to configure authorizations, scheduling options, services, tasks for the visits, reason codes, why did this happen, resolution codes, why is this resolved, along with the billing requirements. We make sure the system is set up and ready for you to be successful in your role. Okay, almost time for the demo. Real quick, I want to use some personas to drive the demo and make sure you understand who will use the system and why. So first, I'd like to introduce you to Susie, supervisor. Susie works at an agency and she makes sure the visits are scheduled and ready for the DCWs. She'll be using some of the modules in the application to do this. And there's also another person who will be conducting the billing, and her name is Brenda Biller. Brenda will bill the payers and make sure the visit data is complete and ready to be invoiced. So throughout the demo, I'm going to be referencing Susie and Brenda and what they're going to be doing as they work with our systems. All right. Are there any questions about the slides before we begin the demo? see lots of questions about when the program starts, and I don't think they're specifically about the demo. Angel, do you see any that you'd like me to answer?
No, not right now, Sean. I'll let you know. I'm just getting these all captured for everyone.
All right, great. Okay, then it's time for the demo. So thank you for letting us go through those slides. I'm going to sign in as Susie's supervisor, and she's going to start her day by scheduling some visits. Okay, so I'm going to log into the application. And when I log in, the first thing it's going to bring me to is the dashboard, but I want to go and schedule a visit. So from the left-hand navigation menu, I'm going to select scheduling. When I'm brought to the scheduling module, the first thing I can do is I can look at schedules that are out there. So I can put in a date range and look at that information, or I can go click the create schedule button over here on the right side. Susie's going to create a schedule for a single visit. So when I click create schedule, I'm brought to the create schedule page, and I'm going to start entering the information so that I can create that schedule. The first thing I need is the client name, so I'm going to type it in. And I can type the first 3 letters, and then it's going to give me a look at some of the folks that are in this system. And I can see if they have multiple programs, so I make sure I choose the right program. So if you have multiple programs, that's okay. You can just go down and you can choose that correct program. So I'm going to schedule, Susie's going to schedule a visit for May Jones, and it's going to be on the 11th. And it's going to be for personal care services. And when I select this option here, it's going to show me any of the services that she is currently authorized for. So I'm going to choose personal care services. I'm going to then choose the 11th. And this is all, like I said before, ADA compliant. So I can toggle with the tab key, and I can use the keyboard to enter in these fields. So the visit is going to be at 3 p.m. And it's going to go till 4 p.m. on that day. And the information from the service and the authorization are already populated for me. So I know the bill unit type, I know the event code, and the next thing I want to do is select the employee. And the status is going to be pending because I'm just building the schedule right now. So I'm going to enter in my employee, and the employee field is just like the client field. I can type in the first 3 letters, and I can find my employees. So I'm going to choose Mary Caregiver. And I can see the authorization. So I can see the authorization information. If I want to see even more details about the authorization, I can click this View Details button. It'll bring me up the authorization information, so I can be really clear about this authorization. When does it begin? When does it end? What's the format? Are there a limited amount of hours? And just get more details before I do the actual schedule. So I'm going to close that. And the next thing I want to do is I want to create a preview of this schedule. So I'm scheduling it for November 11th from 3 to 4 p.m. It's for May Jones with Mary Caregiver. So I'm going to click the Create Preview button, and it's going to create a preview of what this schedule is and if it's going to be, if there are any conflicts involved. And sure enough, there is a conflict here. I can hover over the conflict field, and it's going to tell me it's a time conflict. And I earlier looked, and it's actually Mary Caregiver is booked the entire day on the 11th. So this appointment is not going to work for Mary Caregiver. So what I can do is I can select the row here, and I'm going to delete the preview. Make sure you want to delete the preview. I'm going to say OK. And I'm going to change the employee. So I'm going to change Mary to another employee. Mark is available, so I'm going to give this employee this appointment and visit to Mark. So I choose Mark, and now I'm going to create the preview again, and I can see there are no conflicts with this visit. So Mark is available, May is available, and it's very easy to get this done. So all I need to do now is just click save, and it's going to save this single visit, and it's going to give me a nice warning here telling me if there are any issues with the authorization, if there are time conflicts, or if you've configured overtime warnings. So I click Save Schedules. It tells me the listed schedule has been saved. I'm going to say OK. And I'm brought back to the Select a Schedule screen. And if I go look for it, so if I press, I'm going to look at the 11th. And I can even get more specific here. If I want to just look at May, I could just type in her name, find her. and do a search, and I can see that visit that's been created for her on the 11th. And earlier we talked about Mary Caregiver. She's another DCW that was booked, so I could always come here, and this is where I could really see the schedules for that day. So I'm going to clear this, and if I come back up here and I look at that day in the 11th, and I choose the employee field here, I can start typing in her name and take a look, and I'll be able to see if there's anything that she was scheduled for. And like I said, she was scheduled the entire day for another client, so I'm not going to be able to book her during that 3 to 4 time frame. All right, so that's the first piece. I wanted to show you how to create a single schedule. Next, what I want to do is I want to create a recurring schedule. So this is one where I'm going to be going to this client's location multiple times. It could be multiple times a week, could be multiple times for multiple weeks. So I'm going to do what I did earlier. I'm going to click the Create Schedule button, and I'm going to create a recurring schedule for a client. And the client's name is Jason Blaze. So I'm going to type in Blaze. Here he is. I've got 2 that match that criteria of the 3 letters. So I can get even more specific to find him. I'm going to choose Jason. And again, I've got an authorization, which is great. So it tells me I'm not going to have any problems when I'm going to go bill. I'm going to select service. And this visit is going to be for a date range. So he's going to actually have a recurring schedule. So in order to set that up, you just click this button right here that says by weekday. And this will allow me to create that recurring schedule. And so this schedule he's scheduled from 11/18 to December 13th. And so if I click this, I can again I'm using the keypad right now to find that visit date that I want to get to. So I'm going to choose the 13th of December. And these visits are going to occur, they're going to occur 3 days a week, and they're going to be happening from 1 o'clock to 2 o'clock each one of those days. So I can then move over here and start clicking off these buttons. So he's actually going to be coming on Tuesday, Thursday, and Saturday. I'm going to get the DCW to go out on those 3 days, 3 times a week. And I know the employee that I've already looked ahead and verified that this is going to be okay for this employee, Mr. Sean Demo. And just like before, I see the authorization, which is great. I can look at the details if I want to figure it out. And I can just click the Create Preview button, and it's going to show me the recurring schedule now. So this is going to not just show one single visit, but it's going to show me multiple dates and see if there's any conflicts across those dates. So I want to make sure when I'm booking this that there are no conflicts across the board. I'm booking now 3 visits per week. So that's going to be important that when I build that schedule, it's very clear. All right, so I take a look down here, and the good news is right here where I would expect to see any conflicts, I don't see any conflicts. But one thing that's standing out to me is that holiday that the retail stores don't remember. You know how there's Halloween and then there's the December holidays. There is a holiday in between there, and this is this date. This is the 28th, which is Thanksgiving. I just verify the calendar. Yes, it's the 28th. That's probably not a day that Sean's going to head out there. Maybe it is. But in this case, he's not going to head out there. So I'm going to take that date off by just clicking on the row and clicking delete. And this will just delete that one row. I can select them all if I press select all page rows here. But I just want to delete this one. So I'm going to click delete. It's going to ask me, do I want to delete that selected scheduled previews? I'm going to say okay. And now I can see all those pieces without any issues. So now I've eliminated Thanksgiving, but every other date is fine. So I'm going to save this as a recurring schedule. No conflicts. It's going to double check again, and it's going to tell me to go okay. I'm going to say okay. List of schedules is going to be used to create the recurring schedule. I'm going to say great. And it's going to create it, and I can actually see it here, and I'm on the client, which is great. So I can see those recurring schedules going ahead based off the weeks. And as you can see, week 2, I eliminated that option, so that's why you don't see a scheduled visit at this point. So that's how you create a schedule for a single visit and on a recurring basis. You know, Susie is taking care of her first items on her to-do list today. And what we want to do next is actually see the visit capture solutions. Are there any questions about scheduling themselves that I want to cover before I move on?
Sean, I think you covered this, but just for clarification, we did get a question about being able to schedule a day or entering a large block, so reoccurring schedules. I was trying to see if there's any other specific schedules that came up, and then obviously the ability to kind of in that same vein, schedule things just in time. So can I go in and if I have a schedule, can I adjust that? I know you kind of showed the single schedule and the recurring, but those kind of came up in terms of different questions that were surfacing.
Yeah, you can build schedules based on, like we said, single or recurring. You can build it that same day. So if you have an unscheduled visit and you want to add a schedule for that, you can do that as well. And you can schedule within obviously in the future, and you can see those schedules up to 2 weeks in advance. So if you go to the visit maintenance area of the product, which I'll show in a second, you can see those schedules there as well.
And then Sean, if a schedule needed to be canceled, can that be done as well?
Yes. Yes, you can cancel it from the scheduling page. So I could click on one of the
great,
schedules,
thank you.
and then I could delete it. All right, so what we want to see next is actually see the visit capture solution. So today I'm going to demonstrate 2 visits. The first is going to be using SMC, Sandata Mobile Connect. And then a second visit will be using telephony visit verification, or TVV. All right, so to do that, I want to show my phone. So give me 1 second. Set that up. All right. And let me hide this application and the PowerPoint. And you should be able to see my phone now. Can everybody see that? All right. So the first thing I'm going to do is I'm going to conduct a visit using this product, which is called Sandata Mobile Connect. It's available in the app stores for iOS and Android. So if you look for it right now, you will see this. This is the blue version. So this is the one that will be working with your systems. So I'm going to log in first. And the first thing I want to do is here, and when I'm brought to the first page is here is where I could start an unscheduled visit. If I want to search for clients or look at clients that I'm typically assigned to, I'm going to click the 3 bars at the top left under the time there. And when I click that, it's going to open up to my options, my menu options. And the first option I want to choose is My Visits to see any schedules I have in SMC. So I've got some schedules. I have a scheduled visit right now that's happening right now with May Jones. And so as a direct care worker, I'm going out to May Jones's place. As you can see, the clock is running. So I'm running a little late. I'm going to press that schedule. It's going to tell me where the visit is. So it'll tell me where it is and also the phone number. So if I need to contact May and let her know that I'm on my way, I could do that as well. And if I click this, this location button, it'll jump me to show me a map, and so it'll make it easy for me to get to that location as well. So I'm going to press continue, and it's going to ask me if I want to start the visit. And so because this was scheduled, it tells me what the service is, and it knows everything about this client before I have to do anything. And so I'm going to, I've got to clock in at 10:13. Are you sure you want to start the visit? I'm going to say yes. And when I do that, it brings me in to the application to add tasks, or I can add visit notes. And so I've got a couple here that I've got scheduled. And as you can see here, the plan of care, I actually have a plan of care for this person. So the plan of care is telling me the tasks that I've assigned based off that plan of care. And I'll show that plan of care in a little bit when we get back to the application. I can also add tasks too. So if there's a need to add tasks that are not part of the plan of care, not only am I doing housekeeping today, not only am I doing wound care, but I'm also doing some grocery shop errands. So I'm going to check that one off as well. And that's actually part of the plan of care. So it's telling me that on Wednesday, that's part of it as well, but this is Thursday. So it's just telling me that I'm doing it today. And I have two choices, right? I have a choice to say the task was completed, or I can say that the client refused that task. So I went to the client and talked to the client, and they said, actually, the grocery shop errands are for Wednesdays, not Thursdays. So I'm not going to say we do that today. So I'm going to say, okay, fine. And then I can come down to the housekeeping one. I can say, yes, I'm working on the housekeeping. And I am also doing the wound care that I'm expected to do on Thursdays. And if I need to add any more, I can do that as well. And I can keep going. I can also add a visit note. So I can tell them that that grocery errands were refused today. Great. And so I can just say that. And I can go back, but I can't do anything other than this right now. So if I closed out of the application and I say, yes, I want to sign out, that's fine. I'm going to be brought back to the sign-in screen. I'm going to sign back in, and you'll see that I'm still being required to complete that visit. I can abandon it if I needed to, but I'm going to resume it. I want to make sure I resume it. But the importance is that I can't go on and do another visit while I'm in progress with this one specifically. I'm going to hit resume visit, and then what I can do is come in here and complete that visit. So I'm going to press the complete visit button. I already have my tasks. I already have my visit note. I'm going to hit complete visit. It's going to tell me my clock in time and my clock out time, and my visit note, which I entered in. Grocery errands were refused today. And I'm going to press confirm. And now it's going to ask me to do my client verification, which means I want to give this phone to the client so that they can figure out their answers and confirm that visit. Okay. So I pass the device down, they're pressing continue. And the first option is their language preference. So this particular demo environment I have is set up with English, Spanish, Russian, Mandarin Chinese, Somali, and Persian or Farsi. So I could always choose one of those languages if I wanted to. If the client wants to answer the questions in those languages, hit confirm. And I can always go back and change that as well. You can see all my answers past that would then change to that. So I'm going to say change to English. I'm not going to do this in Russian, sorry. And if you're thinking about what Arizona program languages there are, we've got English, Spanish, Korean, Japanese, Vietnamese, Chinese Simplified, Tagalog or Filipino, Navajo, French, Arabic, Persian or Farsi, and Russian. So those are the languages that are part of the program. So May's going to answer her and confirm with English. So I'm going to press continue. And the first thing is asked, is this the right service that was performed? I'm going to press confirm. Yes, May agrees that personal care service is confirmed. And it was done in the speedy time of 2 minutes. I'm going to say confirm. And I'm going to now allow it to be pressed continue. I can go back if I wanted to, though, and change the language. I can go back to at least that point and continue, but I can't go further back because this is the client that's answering these questions. I'm going to say continue. It's going to tell me, okay, are you confirming this? I'm going to say confirmed. Yes, the service in the visit time. And then I'm going to be given the option to how I'm going to confirm. Am I going to use a signature or am I going to use a voice recording? So for the voice recording, I just press the record button, and typically what we ask is that you record your name and the date. So it's very clear whose voice is on there, and it's the client's voice. And again, ADA compliance there. So if they can't sign, they could do the voice recording. When I press signature, it's a finger, so you sign by a finger on the device, so I can sign like that. And these both, so depending on which one I chose, so if I choose the signature, I can view the signature back in the application, or if I wanted to listen to the voice recording, that will also be there as well. So I can press the play button and I can hear the voice recording. If I don't like that signature, I can press the X button, I can put it in back, but pretty much going to be as bad as it looks there, sorry. So that's May. She's signing, she agrees, so she's going to press continue. It's going to say, yes, this is your identification summary. And like I mentioned earlier, you can always go back if she wanted to use, actually, I want to do a voice recording. She could do that as well. I'm just going to resign again, press continue. And then I'm comfortable with that signature, so I'm going to say submit. It's going to say the client verification has been submitted. They press continue, and the application closes. So they can't go any further after they have confirmed. There's nothing they can do. They can't sign in. They can't look at anybody else's data. Everything is covered there. All right, so hearing there's a couple questions coming in about group visits. So we're going to cover those now before I do telephony, or do you want me to do telephony first?
Sean, because there was why don't you cover that now to stay within the app? Definitely the group visits. There were also some questions about the ability to add tasks, which I know you showed. And then there's some questions about geofencing. So how are those coordinates captured? How do they know? So there was a few questions about that.
So the application is looking at the address of the client to get those pieces. And when we go back to the application, I'll show you, all it's going to show is the clock in and the clock out, the call in and call out. So it's not going to show exactly where they were. It's going to show a general location. The location of the visit will be there though. So you'll be able to see that visit on the map. So I can show that to folks. I'll make sure I do that too. And yes, you can do group visits. All right, so that is the SMC, or Sandata Mobile Connect application. What I want to do now is look at, actually there's one question there. I'll ask the implementation team. So if you've got a client that cannot speak or can't write, how would they confirm? You can skip the confirmation.
Sean, this is Dara. I can also add in that this is one of the elements we talked about that you all are configuring for us, where in that instance, if a member is unable to, for some reason, verify service delivery, a designated person, a person can be designated to do that, and you all will record that in the system.
Thank you, correct. Right. You can have a designated. Okay, I'm going to now demonstrate the TVV application. So I'm going to jump over to my phone and I'm going to call. So the number is an 800 number that's going to be provided by Sandata. And what I can do is I can click I actually know the number. I've been calling it all morning practicing. So here's the number for me. I'm going to press the key, and this might be hard to hear. So I'm going to turn it up loud.
Welcome. Please enter your Santrax ID.
Okay, so the first thing it's going to ask me is enter in my Santrax ID, which is my employee ID.
If this is a fixed visit verification visit using the FVV device, press the star key to enter the visit verification numbers. Otherwise, press the pound key to continue.
I'm not doing fixed visit verification, so I'm going to press the pound key.
Please select 1 to call in or 2 to call out.
So very simple, I choose 1 to call in.
Received at 10:22. Please enter first client ID or hang up if done.
So this location actually has multiple clients, so it's asking me for the specific ID, so I'm going to enter it in.
Please enter second client ID or hang up if done.
Now here's where you can do that group visit. You can keep going. I'm not going to do more than one visit, so I'm just going to hang up. All right, so that's the call in piece. All I'm choosing is who's the employee. If I need to enter in the FVV device number, I can enter that in, but I press pound to get past that. I then pressed 1 to call in. Instead, you can do 1 to call in or 2 to call out. And then if the phone number is shared by other clients, you want to put the client ID. So I entered in the client ID. And then that's all I had to do. So I hung up right after that. Now that was done at 10:22, so now it's 10:23. This is another quick visit. In the interest of making this demo efficient, I'm going to just keep going. I'm going to do a call out now. It's going to ask me to enter the Sandtrax ID again, so it knows which employee is calling in. And I'm going to bypass that FVV visit option. I'm going to then press 2 to call out. And that's when it's going to start asking me more information that you've seen with the mobile device. Things like, what's the service? Are there any tasks? Please choose the task. And then I'm going to do similar to what I did with the Sandata Mobile Connect. I'm going to hand over the phone to the client so that they can do a voice recording, or like Dara talked about, a designee can work with them and handle that piece as well. And once that's done, then the call will be over. So I'm going to call in again.
Welcome. Please enter your Sandtrax ID.
Okay, so I'm going to enter in my Sandtrax ID again.
If this is a fixed visit verification visit using the FVV device, press the star key to enter the visit verification numbers. Otherwise, press the pound key to continue.
And when you get real efficient at this, the DCW can just hit pound right away.
Please select 1 to call in or 2 to call out.
All right, so I'm going to press 2 to call out this time.
Received at 10:24. Please enter first client ID or hang up if done. Please enter the service ID.
All right, so this is...
You entered personal care services. Please press 1 to accept, 2 to retry.
I'm going to press 1 to accept that, personal care services.
Enter number of tasks.
All right, I'm going to enter in some tasks. I'm just going to do 1. So I'm going to press 1.
Enter number of...
I'm hurrying. I'm trying.
Enter task ID.
All right, I'm going to choose the task ID. It's a list that you'll know.
Assist to feeding. You entered 1 task. To record the client's voice, please press 1 and hand the phone to the client, or press 2 if the client is unable to participate.
Okay, so I can skip the verification or hand over the phone. So I'm going to press 1 to hand over the phone.
Please say your first and last name and today's date.
Jason Blaze, November 7th, 2019.
This visit cannot be verified at this time. The service performed was personal care services. Press 1 to confirm, 2 to deny, 3 to replay. Please enter second client ID or hang up if done.
All right, so I'm going to hang up. And if you saw it said it cannot be verified, I did the visit under 5 minutes. So that's why I got that message. We do require that the visit has to be at least 5 minutes. So that's why it said that. But in the interest of time, I wanted folks to hear all the prompts and just get familiar with how to do that TVV visit. So I called in. First, I entered in my ID, my employee ID. I did not need to do the FVV visit, so I pressed the pound key. I pressed 1 to call in. The phone number, which is common, right? A common feature or a common expectation was that you might have a phone number with multiple clients on there. So I had to choose the client ID at that point. If it's specifically for one client, then you wouldn't even get that option. It'll know who it is based off your calling from that client telephone. It'll know exactly who it is. Then when I did the call out, I entered in my ID. I pressed 2 to call out. I skipped the FVV option again because I did not need to do that. And I entered in the service. I then entered in the tasks, all doing this on the phone. And then I made sure I verified with the client to make sure that they agreed with the services that were done. All right, so that's the ability to capture visits using Sandata Mobile Connect, as well as using the telephonic visit verification, TVV, to also do the same thing. I guess we're getting a lot of questions about data. So it sounds like that's something that I think might be helpful to wait for the Q&A at the end. Do other folks on Sandata agree? Can we wait to the end and we'll cover some of that? How do we get the data in and out? I'll take silence as yes. All right, Angel, are you there?
And just a quick note, because I know there were some questions about this. So I know there's a lot of questions in the QA, thank you, and a lot of questions in the chat. I started responding to everyone in QA. I'm kind of stopped doing that. So we are actively monitoring. As posted, we may not be able to get to all of your questions today, but keep those questions coming. That's very important because we want to ensure that you are getting your questions answered, and that's going to also help inform both Sandata and the Access team. But we will try to get to as many as we can. Keep them coming. Again, they're being actively monitored and actively captured.
Yes, we have over 500 people on the call, so I would expect it might get overwhelming if people are entering questions. Like you said, yeah, let's keep the questions going. I'm going to continue with the demo. I want to make sure people can see everything. So I'm going to go back to visit maintenance and give you a good overview there. So let's go back to our friend Susie Supervisor. Now, part of her role is to schedule visits, which she already did this morning, but the next thing she wants to do is go to the visit maintenance module to look at visits for the day. So the first thing I want to do is click the visit maintenance option here. And are folks still seeing my screen? Just want to make sure.
Yeah.
All right, thank you. All right, so when you arrive at the module, you have a search screen, and there are two types of visits that I'm going to be looking for. Those that have been verified, which means all the data has been collected, and there are those that which could have exceptions, which means there's things I need to fix in order for them to become verified, meaning they meet the Cures Act and they collected all the information that the program wanted. And it's Susie's job to review those visits with exceptions to see why they are not moved to verified. So the first thing I want to do is take a look at the visits for today. So I'm going to do a search. I'm going to see some of the visits that I was doing earlier. And the one of them that I noticed here, it looks like it has all the information. It doesn't have a schedule. So you can see I can tell if these visits have been scheduled. I can see if they've been added. But this one I can see does not, doesn't seem like it's complete. This is where I would see a status of verified. And so I'm going to hover over this option here. It says multiple clients with the same phone. And in order to for Susie to figure out what's wrong with this visit, she's going to actually click the visit. And that brings up the visit details screen. So she goes to visit details and she starts reviewing the visit. So she can look at these tabs. So the general tab is going to tell you everything about the visit. Was it scheduled? What's the visit start date and end date? When was the call in and the call out? What service was it done for? Was there a client signature? As you can see down here, I have a client signature or an audio recording. I'm not sure you're going to be able to hear this, but I am going to press play. I think it's hard to hear in Zoom. I don't know if you're going to hear it. So if you didn't hear that, it did say, it was me saying the member's name as well as the date. And if it was a signature, you'd see an icon that looks like a picture icon. So you click that and then you would see the actual signature. I'm going to review the client information. Where was this client? I'm going to review if they have any emergency contact information. I can add that or make sure I understand that as well. I can look at the employee information, make sure that's clear. I can review the call log. So I can see when was the call done, and I can see what call type it was. So as you can see, this was a telephony call earlier where I called in at 7:35 and then called out at 7:42. And it tells me which phone number did the call originate from, which user it was, which time zone, and the call source being Sandata, because we're using the Sandata toll-free numbers that were provided. And I can look at these other pieces. I'm not going to see any GPS location because it's a telephony call. If there's a mobile call using SMC, I would see some GPS locations. Right now, the GPS map will tell me where the members or the client is located, but I'm not going to see a call in or call out specifically from that location. So when I look at exceptions, this is what I really want to focus on is the exceptions. Are there any exceptions? And when I did the call, I did not, I purposely didn't choose a task, so it would show up showing as a missing task. So tasks are required for this visit, so I needed to put a task. I did not put a task. So the direct care worker did not put a task. And so Susie reached out to the employee and verified what task was completed and why it was not entered. So she got that information, and then this is where she can fix this visit so that it will then be verified. So I'm going to go to the task tab, and here's where I can add a task. And the task was assist tube feeding. So I find that task. Again, I can use the tab keys if I want to select the reason code. This is where, why is the task not there? Did the staff enter a wrong Sandata ID? Did they, and these drop downs are all built by the state, so they'll be really clear. Is there no out call, no in call, no call received? Was there a flow not functioning? What type of issues were there? And I'm going to just put update the tasks as the reason for this one. And I can also set a reason note. So if I want to report no task was recorded, and then I just hit the add button and the task will be added. And it'll tell me success, the visit is successfully updated. I see the task up here. If I entered in an error, I could delete it. But this is the exact task that was done. It was just one task. And if I go back to the exceptions tab to see if there are any exceptions, now I see no data found, which is what I want. I want to make sure there are no exceptions, there are no issues with this visit. And it might be hard to see. If you look behind though, you can see the visit is now changed to verified. So now it says verified here where it said incomplete. And I can verify that. I can verify the verification. If I go to the general tab, I can take a look and see the visit status right here. It says verified. So I'm able to make sure that that visit is now verified. I can then move on to the next pieces, which is billing. So I'm going to close this window. And now that they're verified, if I do another search, and my search right now, when you come in here, the default search is to filter visits by all exceptions, because Susie wants to come in here and wants to see the ones that are problems first. Those are the ones that she really needs to deal with on the day-to-day basis, make sure there are any issues with those. So she's going to press search again, and that visit's not going to be there anymore. So now there's just 4 here. And but I can still look at that visit if I wanted to by doing this. I can either, first thing I need to do is say, I want to look at all visits. I don't want to look at specific exception types. That's a fun one. I can choose exception type and say, I want to look at all the ones that are missing tasks. I want to look at all the ones that are missing without visits without in calls. You know, this is the way I can really verify and get specific on certain ones and follow up on those as well. But if I choose all visits, this is going to show me verified visits. I can come up here and choose the visit status. So I want to see the ones that are verified, processed. I'm going to choose verified. Do a search here, and I can see here are the 2 visits that have been verified. One has a schedule and one doesn't. And that, again, this orange indicator is just saying, look, you've got multiple clients with the same phone. Just be aware, make sure that you understand that. All right, so Susie then completed that item, and she sees the visit no longer the exceptions, and it's verified. So she's been going through and working all morning and scheduling new visits. So she goes to lunch, and when she gets back, when she logs in, she's brought to the dashboard. That's the first thing she's brought to when she logs in. And here on the dashboard is where she could even, even before we started scheduling, even before when we began the demo with scheduling, she could even start the day before that and go in on that, or go in like right now at this very moment. And the most utilized information on this page is the no-shows. So I can look at, are there any no-shows? Are there unknown clients? Are there unknown employees for visits? Are there unscheduled visits? Can I take a look at those? So I'm going to take a look at no-shows. If I click the number here, it's going to give me a brief explanation and a brief start time for these 2 clients that did not get a visit. So we had one for Jimmy and one for Tori. I can export this list if I wanted to just export it and make sure I understand what it is. It's just these fields right here. But if I wanted to get more details and get really into why is this happening, I can click the no-show header. And this header will jump me to visit maintenance, and look what it did. It brought me to these exact ones, but look here, it forced the exception type of no-show exception. It allowed me to not have to put in any search parameters or anything there. It went right to today's date, right to that no-show exception, And now I can try and understand, why did these 2 visits not have an employee show up? And you can see this is another warning saying, hey, by the way, not only did they not show up here, you have no call-in, you've got a no-show exception, but we also don't have a client verified signature or a verified recording, so there are verification at all. So again, it's something you would expect to see on a visit because it's not done. Once these get done, and once this gets rescheduled and those other pieces are done, then you would see a verified visit once it gets to that point. Another way you can monitor visits, not only here in visit maintenance, but you can run reports. So if I come over here to the report module and click reports, I can run daily reports or I can run date range reports. So if I wanted to see all the active clients, so let's say I want to look at all the active employees. Who are the active employees for today? Exactly today. So I looked at those no-shows and I said, hey, why aren't they get scheduled? I got to verify if those employees are even active today and reschedule those visits immediately as soon as I can. So I'm going to run the report, and it's going to give me a list of those clients. It's going to tell me their information so I can get their email, I can get their phone numbers, so I can give them a call. As you can see that this might be really small. I'm going to just make it a little bit bigger. I know what it's like on these presentations. They can be tough to see sometimes on your screen, but you can see that information. I know I need to call. I can get their email, and it's going to mask some things like their socials, so I don't know their socials. It gives me their Santrax ID. So this is the one I was using earlier, Mary Caregiver, and you'll see there's a lot of movie stars here, or TV stars with the 555 numbers. So, but I can give her a call and see if she can maybe cover those visits that were missed. All right, I'm going to keep it. I'm going to put it down to small again, and then I'll bring it back up so you can see the reports a little bit better. I'm going to go back and let's say I want to run a date range report. So I want to see all the visits that have been done, client visit summary. I want to see all the client visits that have been done in a certain date range. So this is looking at the last 2 weeks, so 10/24 to 11/7, looking at a whole day. I can get even more specific if I wanted to look at only services that like personal care services or however you set this up. So I'm just going to leave them all, but I could take this off and just choose one if I wanted to. I'm going to say select all. I could get very client specific. So there's a lot of parameters here. Same with the daily report that you can manipulate to make sure you get your information quickly. I'm going to hit run report. And again, I'm going to make this big so folks can see it. And you can print this out at any time. You can export to Excel. But here you can see all the visits for this specific client. And I've got 7 pages here. So I can go to the next page. I'm going to see all the visits for the next client. This is for Jason. So Jason, these are all the client visits that he had. I can tell which ones have been done with the mobile device, with his GPS information. You can tell which ones have been changed. So these ones were then changed after they were done, and et cetera. So I can keep looking in and I can see all the client visit summaries. I can get a real good understanding of what clients were being worked on in the last 2 weeks. So there were reports for clients, there were reports for schedules, employees, billing, all the areas that you would want to review at any time.
Hey, Sean, there's a quick question on the reporting. Are you able to export reports into like Excel or a TXT file, and is that easy to do?
Yes, if you see this button right here, it says export to Excel. So I just click it, and you see down below here, it did export it right here. I could bring that up. This might be on my other, I've got dual monitors, so I might have to grab it. Give me 1 second. But it'll open the, if you have Excel, it'll open the report. And so I'll bring it over so you can see that, and it's broken down by the same thing as things that we were seeing before. So I can see the actual information, and all these pages are here. So we had 7 pages, so you're going to see 7 pages. All right, one more very important module that Susie also reviews is the plan of care module. I know we talked about that earlier in the slides, as well as I talked about it during the SMC piece. So when I click plan of care, I can view the plan of care or I can create plans of care. So if I click view, it's going to allow me to take a look. I can look at the plans of care over the next week or since the beginning of the month. So I've got the 1st to the 7th. I'm going to click search. And here are the 2 plans of care that I have. And I can go in and edit that information or remove them depending on my permissions. I can go take a look at one that's created. So if you notice, this is the person that I was looking at before, May Jones. She's got personal care services and she has a specific date range for her plan of care. So she's got from the beginning of November to the end of December. And here, just like you saw in the demo, here are the days that I had chosen. So Tuesday, Wednesday, and Thursday, 3 days per week, the total of about 5 hours per day. I can go and click the next button and it's going to bring me to the actual plan of care. And it's going to show the tasks. So I can see all the tasks that are set up. If I need to add some tasks that are done, then I can do that as well. You can see that grocery shop errands one that we said was not being confirmed by the client, saying, no, I don't need that today. So here's that one that's being done just on a Wednesday. And so if I had to add another task, just come up to the task window, choose the ones that I need. Again, these are ones that will be built into your program. I can select a limit time. So if I want to say, all right, well, there's no limit, but I want to limit the time by day or week, month. I can select the limits unit. So is it by dollars? Is it by hours? Is it by miles? However you want to configure the application for that. All right, and then I can enter the limit. So if it's hours, if the limit is 5 hours and you can only do a certain amount of days per week. I like this. You can come down here and click the days per week and they'll automatically fill in for you. And notice it became a required field once I entered it in there. So you see the asterisk. Yeah, if it might be hard to see, there is a little asterisk right there, making sure that it's a required field because I'm answering some of the questions down below here. So I can, so Susie can ensure the plan meets the member's needs and enter in more plans if needed. So that's another thing that it could be part of her role. She wants to make sure. All right, I'm going to cancel out of that one. I'm not going to make any changes. Give me a little message. Do you want all my changes will be lost? I'll say, yeah, that's okay, no problem. And if I wanted to enter in one very similar to what we did before, press the Create Plan of Care button, bring it up, ask me to find the client. So if I don't have one for Jason yet, do a search, find him, select him, and then move on and create the plan of care. I'm going to skip that for now, but I want to make sure we covered that during the demo. All right, that is really the crux of everything that Susie Supervisor is going to be doing. What I want to do next is just check, are there any questions about scheduling, reports, dashboard visits? Because the questions are flying in, do we want to just wait till the Q&A, Angel?
I think so, because I've been trying to group these a little bit in some of the themes. So let's have you continue, and then I think we can circle back during the QA period.
Okay. All right, so now we're going to see how Brenda Biller uses the system. So Brenda logs in and she wants to go straight to billing to create invoices and review those that are not okay to bill yet. So the first thing she's going to do is she's going to go to the billing module and she's going to go to the Create Invoices screen. And the first thing I want to do is enter an appropriate date range. I can choose by payer. So if I have multiple payers, I can choose multiple payers. I've got 2 payers set up in this system. So I can be very specific. And then these 2 checkboxes are important because these are going to help drive, are things okay to bill or are they not okay to bill? And so I'm going to check off to show only items okay to bill. And when I click that and do a search, I'm going to see all the options and all the visits right now within this date range of the month of November. This date will keep rolling until the end of November and then I'll switch over to December. That's a configuration. And this will allow me to look at the visits that are now available. And they, as you can see, they do not have a not okay to bill reason, which is great. But let's say Brenda comes in here and she just wants to verify, are there any that are not okay to bill? Do I want to look at any of those? When I click that, I get a little warning saying, oh, by the way, these displayed results are not the same as the search parameters yet, because I haven't, they reflect that previous search. So I need to press search again, and it's going to tell me, okay, I don't have any. If I go back here though, I'm just going a little further back, just because I do have an example that I want to show folks. So this one comes up with a not okay to bill reason that says no amount calculated, quantity is 0. And you can see that right here, right? Quantity is 0. So how would I fix that? How would Brenda Biller fix that? She would click on the schedule. She would go into the schedule, and then she would address it if she needed to. And I'll show that in a second. Let's walk through creating the invoice and then the submit invoice, and then I'll come back here and we can show that piece as well. So I'm going to go back to show only items okay to, actually, I'm going to clear the search. Come back to the November timeframe. I'm going to check off show items only okay to bill. Say okay. And here's where I can get even more specific, just like we've done before. So I take a look. I don't see any names that are the same. So if I wanted to, I could just grab all of these, or I could be very specific and say, actually, I just want to grab Jimmy. So choose Jimmy. Again, the search parameters are different. So do another search. I'm going to wipe Jimmy out. I'm going to take everybody. So let's take a look here. I get a total, so I know it's $49. Here are all the amounts that are done. And so the next piece I want to do is create the invoices. So I come up to the top here, I'm going to hit create invoices. And it's going to tell me that, and just verify that everything's okay. It's going to give me the invoice date. This is important because this is not the visit date, it's the invoice date. And I can print all the invoices created. I can print a summary report. You can also send printing to other places if you configure that. I'm going to hit create invoices. It's going to tell me invoice creation is running. You'll be notified when it completes. So if it's a big job, you'll get a notification when it's done. Because I just had 5 records, it's quick. So it's going to tell me that's finished, 5 completed, of 5 processed. I'm going to say okay. And that's the creation of the invoice. So the next thing I want to do is actually submit the invoice. Now that it's created, I want to submit it. So I'm going to come down and click submit invoices. And here's going to look at across the month. So it's looking at the entire month. I'm going to hit search. And it's going to give me a list of ones that are from today and one that I had yesterday. And so great, I've got all my invoices. This looks great. I'm going to hit submit invoices. And it's going to give me a message that says that I must include a payer selection to perform an export. This is a great gotcha, so that you're not sending the wrong payer information in an invoice. So I say okay here, and I want to make sure that I select the payer. So I'm going to select payer I, do a search, and as you can see, the only payer I is only for Jason. Payer P has the other invoices that are the other invoices that we had created. And they all have the invoice date of 11/7. That not necessarily was the visit date, but that is definitely not the visit date. It could be, but it's, in this case, we know that those visits were, some of them were created today, some of them were created the day before. So I've got the ones that are now I've got payer P here. I can now click that submit invoice. Another thing I want to point out is we can handle multiple 837s types. So this one says 837P. Watch when I select payer I. This is set up for 837I. So notice it changed to an 837I. Again, I got to do another search to show those. All right, back to payer P. And back to 837P. I'm going to press the button submit invoices. I've now done a search by the payer, so I shouldn't get that warning message that I got before. I'm going to get a message that's asking me, do I want to export the invoices matching the search parameters? It's going to give me an option. If I was first coming into the system and I wanted to add the submitter ID, I could, but once I add it, the system automatically is going to default that for me. If I need to change it, fine, but you probably don't need to, so you just hit OK here. And it's going to create the invoices. And this is an option. You could download the file and look at it. I'm going to say no, I'm not going to look at the file, and I'll show you why in a second. So I've submitted the invoices. So I first created it, I then submitted it, and now I want to look at those submitted invoices. So that's the last piece of the billing module where I go to submitted. And this was today, so I could get very specific and look at just what are ones that are submitted for today. And I could select the payer if I wanted to. So I'm going to do payer P. Great, awesome. I can expand this. Let's say I want to look at all the ones for November, and I'm not going to select a payer, so I can see across the board. So I can see payer I, payer P. And now you can see these are the 837s that have been created. And I've got two different types. So I've got 837i and 837p. So I'm going to click on this one that was just created. And it's going to tell me the records, the 5 records that we saw before. Then tell me the amounts. And it's very clear on this page. But if I want to see the raw file, I could actually click this tab and see the raw file. So folks that understand these files would be able to come in here and actually see how that was created and what it looks like here. In a nice format that's easy to read, a lot easier than if I brought that downloaded file using Notepad or something like that. So we try to make this really clear so you can look at the file. All that information is here, and you can look at the data on a cleaner version here as well. All right, let's go back and look at that other piece I was talking about. Jumped ahead of myself because this is a fun part to do, or something that Brenda really needs to take care of to make sure that all her visits are billed. So I'm going to show items only not okay to bill. I'm going to jump back. Remember, this one was a little further back in October. And so I see here that there's no amount calculated and the quantity is 0. And here it is. That is set to 0. So how do I fix that? Well, I can look at the authorization. I can get more information by looking at the client. And this option over here, the pencil, allows me to jump to the schedule. So I click on Edit the Schedule. This should look familiar because we built this earlier in the demo. And I come down to the billing section here and notice that here's that quantity 0. Quantity 0, so the bill amount 0. And this could be because your billing rules are set up and they didn't meet. This could be a quick visit and it didn't meet the amount of time it needed. So I can click this override button, and this is only if I have that permission. Click the override button. I could put the quantity is actually 3, and that would change the bill amount to 12. And then I just save it up, and then I would go back to billing, and that would be confirmed. So that would not be I would show up in the OK to bill section, and then I would be in a good shape. I could then go in and go through the process that we just did: create the invoice, submit the invoice, and then view the submitted invoice. That's another role that Brenda does. She goes in, not only makes sure that the visits are created with an invoice and then they're submitted. She also goes back and looks at the visits that are not okay to bill and make sure they're okay, and then so they can move on in the process. So maybe she does that before she does the submitting, make sure everything's pulled together, but that's another thing there. All right, I like this example, so I'm going to just close it. I like to use that in the demos. But that, if I did put that $12 here, you'd see it here. If I chose show items only okay to bill, then I would see that option. If I came back and chose only not okay to bill, that record would not be there anymore. All right, so that's Brenda Biller's role. I wanted to touch on one more piece.
Hey, Sean.
Oh, go ahead.
Sean. Yep, real quickly, from a billing perspective, and you probably already addressed this, we did get a couple questions. First one is, how often can billing be submitted through the system? Yeah, I mean that's an option that you can decide. I mean that's really how are you going to be doing it? I don't think there's not a limitation. Okay, perfect. Thank you. That's what we needed to find out. I think obviously the limitation is if you don't have any visits that are ready to be billed, then you're not going to be able to bill. So that would be the one limitation. All right, thanks. Sorry, sorry. I know folks have been watching this demo for a while, so I just want to wrap it up. I wanted to show one more thing, and we've covered Susie and Brenda's roles, but I wanted to briefly touch upon user security. Sandata works with the state to help define user roles. So if I come down here to security, I can look at the user roles, and again, only if I have that permission. So this would be something that Susie and Brenda probably don't have. Susie and even Susie and Brenda would probably have different roles. So you can build a role for billing. So this is just assign users that can run the billing application, and specific to their needs, specific to things that they would do. They would go to the dashboard, they could run reports, they could look at the visits, they could conduct the billing. Very specific to them. So we want to make it very easy for you, and we want people to use the system the same way, so they won't be different forms of access. So these roles will help you maintain your system in an efficient and a non-abusive way. So Susie and Brenda are not administrators, so they would not need the specific module, but admins will want it,
And they want to make sure folks are using the system the way they need to do their jobs. So I wanted to make sure folks understand that this is the way that you can set up roles and assign folks to the roles. You're not going into every individual. And if I went into some of these individuals and manage users, I would then look and they would be assigned roles instead of I can assign them multiple permissions. You can just use privileges, but roles are really the best way to go. This really helps you in maintaining the system and making sure that you're not chasing down folks that have different access than the others when they have the same role. All right, we made it. This is the end of the formal demo. I know there are a lot of questions. There are a lot of folks on the line.
Yep. Sean, so there was a specific question about how to set up an employee in the system. Are you able to show that?
Sure. And this all depends on how your system is created and used. My understanding is that Arizona, you're going to be helping to add those employees through feeds, correct? I know you're doing it for authorizations and clients, but let's say there's a new supervisor that's going to start tomorrow and it's not going to come in right away. I need to start getting them into the system and I want to make sure they're using the system. If they're a supervisor, I'd want to create them as a user first. And if they're just a direct care worker, I would want to go to the employee section and I can look and see if they're already in here. Sometimes, it's good to just double check, make sure you don't have any duplicate entries. But if I did a search and I didn't see that person, Shane Demo is the new person. He's going to be doing multiple pieces. I do not see Shane Demo. I just see Sean Demo. So I can hit the Create Employee button. And this will ask me their first name and their last name. So I'll enter that in. Are they a supervisor? So I could verify if they're a supervisor. If they're just a direct care worker, then I don't need to make them a supervisor. They're not going to ever use the EVV system. They're just going to be using the mobile device or the telephony or the FEV visit verification devices. And so I can choose their permission, their position. Again, this is just a good way to verify who they are. And actually, Shane's an RN. I can put in their last 5 digits, so a good way to not have to add all that information. And then I can put in his phone number. And so I click Create Employee. And the first page is going to ask me anything to do with their personal information that I want to continue to fill out. Those are just kind of like the quick wizard. Get that information in. I can put their address in. I can put in the address type. So if I want to put in their business and I want to label that, that's their work. I can type. And here I'm just going to put the zip code. When I put the zip code in, nice thing there, it defaults the city, county, and the state for me. I can put their email address in. This will be important when I set them up. If I need to set them up as a Sandata Mobile Connect user, I'll show that in a second. So I verify. If I need anything else to enter in, I can give them a registry ID. If you have employee registry numbers, I can give their birth date, their gender, primary spoken language. All these are things that you can determine. I need to have at least one phone number for them, so that's required. You can enter multiple others. This feature is also available when you build clients. I can add a contact. This is how you can add designees. So I can add the information. I can choose a type of person this is. This is their emergency contact. So I can add their emergency contact information and their address. And then down below here is where I can determine, are they active? Are they, again, I can answer, are they a supervisor? And then are they a rehire? What's their position? I can determine their employee ID, or you can have one default through the system. That's usually what we do. We have those created and defaulted unless you've already chosen them. And this is going to be important. Now notice this email field up here on the right. So I click mobile user. Now you see the red asterisk. So now it becomes, hey, if they're a mobile user, how are they going to sign into the mobile application if they don't have an email address? So we want to make sure that you put that email address if they are a mobile user. And when I save this up, they would get an immediate login email telling them how they can log in. They'll go and with a temporary password, and then they can log in at that main login page. All right, so this one is Shane is 122323. I can choose him as supervisor, or I can say actually his supervisor is Ford. And I do have mobile user checked off, so I'm going to uncheck it. But if I did that, then you get the email. And I can also, this is not going to be helpful because I'm just creating the employee, but when you have created employees, you can go to the schedule tab and you can see any schedules that are assigned to them. So it's really helpful to, if you're trying to figure out who's available and what I want to do with that employee. So all I have to do is hit save, and it'll tell me the changes have been saved successfully. All right, so like I said, I'm done with the formal demo, but happy to help answer questions. And if there are things that folks on the phone want to be seen or shown, just feel free to ask away. And I want to say right now, just thank you for the opportunity to show you the Sandata EVV solutions. Really happy to show you these today.
Sean, real quickly, and I know Dara wants to kind of chime in some of the things that are popping up. Could you potentially just, since it's more system level, at a high level, talk about integration capabilities? So obviously from a Sandata perspective, our ability to integrate with other systems, we obviously don't have the specifications today during the call, but you know, the capability exists. So is there a way that you can kind of talk about that at a high level?
Yeah, and I'm wondering, it might be helpful to bring in some folks on the implementation team to talk to that, because they have such experience with working with the state and explaining those options. Is there anybody on the implementation team that want to take that one?
Angel, could you Angel, could you rephrase the sort of the questions that you're getting? Again, I'm sorry.
So the main question, I think that, and I'm summarizing this, there's a lot of individual questions, but I think the main questions are, does Sandata integrate with other systems? Obviously the answer is yes, but, and then the second kind of component to that question is, when will specifications be available so people can understand, moving into more of the alt EVV realm, if I have another vendor, what can I give them? What does it look like? When will it be provided? So kind of two types of questions there. An alternate EVV vendor, excuse me.
So this is Dara. I can address that initially, and then if other folks from Sandata want to chime in, please do. So in relation to the all EVV vendors, Sandata has specific basic general technical specifications and requirements that are needed to be able to send data to the aggregator. What we are working on now in partnership with Sandata is identifying, based upon our program goals and our strategy around EVV, what are those additional requirements that might be Arizona specific? And so we are actively working on that currently. Once we finalize that, we will post that to the website, as well as we will give instructions on how providers can submit and start communicating with Sandata about the alternate EVV vendors that they use, to then start talking about testing and things like that to validate that those systems meet the requirements. One of the things I do want to clarify is that providers will be facilitating the conversations and be identifying the alt vendors that they use versus Sandata working directly with the alternate vendors. So the folks on the Sandata team, maybe you can clarify additionally, but initially will be that conversation will be facilitated by the provider saying, I use this alternate EVV vendor, and communicating with Sandata and then starting that process.
Someone might be on mute trying to answer.
Hey everyone, sorry, this is Ruth Sewell, Sandata Project Manager. Dara, you outlined that absolutely correct. Sandata's got a whole team of folks that will help assist those providers using alternate vendors in that testing process and making sure that we're passing data back and forth properly.
Great.
Angel, this is Dara. Would you like me to start going through some of those general themes of questions that you've been receiving? Would you like me to start working through that list?
If you wouldn't mind, I think so. I think that covered kind of more of the system, and I think some of those cover a little bit more policy. So if you wouldn't mind going through those, and if anything new pops in, either we'll take it or we'll let you know about it.
Okay. Great. This is Sarah Johnson from Access again. I may need to refer back to some documents and emails. So if there's a pause between when I'm speaking, just bear with me here. We're trying to be very responsive to some of the major themes that we're seeing as far as questions. So number one, since we are kind of talking about billing at this point, I do want to clarify that the billing component is optional. It's a tool we wanted to make available to providers. You may continue to use your billing systems that you use currently, and it is optional to you. The other thing I want to clarify for those those providers, excuse me, that are contracted in billing DDD. DDD is currently working on updating their claims processing system, and until that effort is completed, which is estimated for March of 2021, if you're a DDD provider, you would not be able to bill DDD through the Sandata system, so that there's just a limitation there short term. But once DDD updates their claims processing system, again, looking at March 2021, then you would be able to use the Sandata system to also include your billing. So I just want to clarify that for those that are DDD providers. Regarding the cost of the system, I don't know if whoever had the PowerPoint, if we can go back to the PowerPoint and to slide 12. So I think there might have been some folks who missed some of the initial introduction. So as Arizona's approach to compliance with EVV is we have opted to do an open vendor model, which means that we as the state Access have the first component of that model is that we have selected a state vendor, and that is of course Sandata. And Access is providing the funding for the development and initial implementation of the system for providers to use the system. We are bearing the costs of the system. As we move forward in future years around ongoing maintenance, we are always going to continue to look at the financial models and determine which is most cost effective. But our goal is to make sure that the cost to providers is, or any cost that may be incurred by providers is cost neutral, meaning we would make the provider whole. So at this point, we are bearing all the costs directly. In the future, that finance model may change, but our goal would be to maintain cost neutrality for providers. So ultimately, in the end, providers would not be bearing any additional cost for the system. That said, if a provider chooses not to use the state selected vendor, then and choose an alternate vendor, which is your business decision to make, you would be responsible for costs associated with any updates you need to make to your system, or and anything that would be necessary to comply with the requirements, which will be forthcoming. On to the next question. So there was a question regarding.
Yes. There, I'm sorry. there was a clarification question. Could you clarify the DDD billing again? So the specific question is, did you say that DDD billing system is not expected to interface with Sandata's billing system until March 2021? So could you just clarify the expectation between EVV and billing for that?
So in regards to billing, billing is optional to begin with. Providers do not have to bill through the Sandata system. The billing module is an optional tool for providers. If a DDD provider would like to avail themselves of that option, they would need to wait until DDD updates their claims processing system, which they're in the process of doing, and that would be March 20 of 21. So if you want to use that feature, it would be in the future when that feature would be available to you. You're welcome to submit additional questions to us after the webinar. That's the extent of my understanding and knowledge at this point regarding that, that item. So I don't really have any additional information to provide to you, but if you have additional questions, we can work with DDD to get those answered. We had a question on how EVV works for the tribal community. So for our colleagues at Sandata, if you can pick the slide that goes over the different device options, that would be great. So in regards to one of the things that in selecting a vendor, we wanted to make sure that one, we're compliant with EVV, but two, that we had multiple ways that individuals could verify service delivery through EVV, and one, accommodating just different preferences by members and their families, but two, also accommodating areas where individuals may not have access to any kind of cellular service or internet service. So there's a couple different options. The first option in those instances would be if a member is in an area where there's no cellular internet service, but the caregiver coming to the member's home would potentially have cellular or internet service after care delivery has been provided. The DCW can use the Sandata Mobile Connect application and smartphone and enter everything just as you saw Sean demo, and it would be in disconnected mode. And that would mean once the caregiver left the home of the member or wherever they were providing services, that if they were able to get to a place where a connection could occur, it would happen almost seamlessly and automatically. If the caregiver is also unable to access cellular or internet service, then the option would be the fixed visit device, which is essentially a device that's battery powered, that would be put in the member's home. The DCW would go to the member's home to provide care, would click that device and get a 6-digit number that is a time and date code stamp with it, and they would enter that digit on a paper timesheet when they were starting to provide service, and then would follow the same process when they would end. So there's multiple options for areas of the state where there is limited or no connectivity. Excuse me, I'm just looking at the questions here. So there's some questions about training. So this is actually not designed today to be a training for providers. What this was, the purpose of today's session was to be a demo to help providers understand the basic functionality, look and feel of the system, how it functions, what we're going to be incorporating into the system that doesn't the functionality doesn't currently have, to start helping you as providers think about what your options would be and what decisions you want to make about which system you want to use. Training will be forthcoming, and when we update the timeline on the website later this month, we'll include more guidance around when you can expect training. So we are actively working with Sandata currently on a training plan that addresses all stakeholder types. And we're starting with developing the training for you as providers, but there will be forthcoming training for members and families as well. How members and families will access training will generally be through the provider agencies. We'll arm you with tools that you can use to help educate members and families. So all of that we are starting to work out, and more details will be forthcoming. But once we update the timeline, you can get more information about training so that you can plan accordingly to make sure to be available and be aware of those opportunities. Regarding the designee, again, this is something that Sandata will be configuring for us, so we're still very much in the planning phase. But the idea is that if the member is unable to verify care delivery at the time of service, that there could be someone that's designated to verify that service on their behalf. We recognize that there is a large contingency of our members that are receiving care by their families that actually live in their home with them, or others that live in their home with them. Some of you may be aware that CMS did issue some guidance, actually just a couple months ago, regarding this, and said that and gave states the flexibility to consider whether or not to require EVV for circumstances under which the member and the caregiver live together in the same household. And what Access has planned to do is utilize that flexibility that CMS granted and still require EVV for live-in caregivers. And that's primarily because we want to make sure and track and monitor timely service delivery and access to care. Again, we stated that's one of our main goals for this program. That being said, we want to make sure that the clocking in and clocking out experience and how that works is something that is supportive of these types of arrangements and is flexible. So we are currently working on those different options with Sandata, because we want to make sure, again, that we support members and their families with how they manage their care, including scheduling and certainly how care delivery looks like in the environment in the situation when you may have a live-in caregiver. So more information on exactly what that will look like in the future, but our commitment is to make sure that whatever is designed is making sure that it's the least burdensome option that we can come up with while meeting over our other goals. I don't know if it would help. There are some still questions about who EVV applies to. So Sean or Angel, if you could go to slide 14. So as we mentioned, as we talked about before, but we'll continue to go over it again, and the same list is on the website as well, that these initially are the provider types that are subject to EVV. So we've listed the access provider description and then the access provider type. So if you look at these provider types provide services to our members across the board. These are physical health care providers, these are behavioral health providers, and these are long-term care, home and community-based providers. So if you are one of these provider types on slide 14, and you answer yes, I am one of those provider types, then you look at the next slide, which is slide 15, which outlines the services. So we can go to the next slide. Thank you. So if you provide, again, one or more of these services on this list and you say, yes, I provide those, then the next thing is to look at where you provide those services. So if we look then on the next slide is the place of service. So it's either home or the other place of service, which we understand is generally used for community-based services. If you go back to the slide previously, the slide 15, I do want to highlight for you when we talk about personal care and home health services, some of you may be asking, why are there things like habilitation here? Why are there some things like therapy? And the guidance that we got from CMS was that we needed to look at our authorities for providing these services, whether it's our 1115 waiver or our state plan, along with the federal regulation in defining these services. And in doing that assessment, it was these lists of services that we felt, based upon those authorities and documents and regulations that for Arizona are required for EVV. So that is why you see things like skills training and development and habilitation on the list, and some others that you might not necessarily have thought of when you looked at that. We took the guidance from CMS, looked at our federal authorities and providing care and the services we provide and the federal regulation, and this is how we came up with the list.
There is a quick, I didn't want to interrupt you because I know there's a few more, a quick clarification question. This might need to be addressed offline, but there was a question from a provider asking what if they don't provide the services as listed. Is that something that you may need to address separately?
Yeah, if you don't provide these services, then EVV would not be required for you. If you feel like you still have some outstanding questions, Danielle Ashlock is my colleague who's assisting with EVV. She and I are the two people who received the email, the EVV at azaccess.gov email that's provided on our website. We respond to those. We are happy to talk with you specifically to see if we can offer any further clarification. Angel, can you elaborate on the questions you've been receiving about home versus community?
I will, but before that, I know you clarified billing as optional. There were a few questions regarding scheduling and whether or not that was mandatory or optional. Could you please clarify that?
Sure. And if you can go back to, I'm trying to think what slide it was on. We did go over, the slide we talk about the access to care. Yes, so scheduling is required because that's part of our goals in trying to measure access to care. So for those of you who are in our long-term care program, you're familiar with the gap reporting requirements. Gap reporting will be replaced with EVV. So some of the manual types of functions that you perform today around gap reporting. I do want to talk, I think there was a question I saw related to contingency planning. Somebody who is maybe a behavioral health provider who may not have been familiar with it from the long-term care side. Folks in the long-term care world are familiar with it, but contingency planning is basically your backup plan. If something occurs where the service cannot be provided as scheduled, then the contingency planning is something that helps inform what the provider does in the event that occurs. So there's a conversation that will happen with the provider agency and the member to plan for these circumstances. and then getting the member's preference. So some of the things, we're still kind of working this out as well with our provider cohort or our advisory group that we've been working with. But to give you an idea would be that the provider agency would work with the member to identify if attendant care is scheduled for 8 a.m. in the morning and something occurs and the worker gets sick, the direct care worker gets sick and is unable to come and provide the service. But we don't find that out to maybe 8:15. The alerting happens in the system. The care coordinator, whoever that appropriate term is at the provider agency, would contact the member and say, hey, your attendant care worker is sick and unable to show up. What would you like to do? So there's a pre-conversation, and then there's also a conversation on the day it actually occurs. But the options that the member could pick from would say, oh, as long as I have somebody today, then I'm fine. Or no, I'm actually going to need somebody within 2 hours. Or you know what, I don't need my attendant care today. If I have it tomorrow, that's fine. Or, hey, my sister lives with me and she can provide attendant care. She can assist with my needs today. And so it's okay that the worker doesn't need to come. So based upon the member preferences, the provider agency would respond, and then that would be documented in the system, and then that will help us measure access to care. So going back to the question about home versus community, Angel, can you help elaborate on that?
Yeah, and that one we may have to do as a follow-on. I know a lot of questions we're not able to get to today, but I think there was, as they were coming in, as Sean was kind of going over the demo, I think the question was, well, what if we provide services in the community? Or, what if there's a scenario where the caregiver has, there's a youth event and they're going there for service? So I think there was questions regarding, yes, we understand, services provided in the home, but what happens when service is provided in the community? And I think we covered that, there is flexibility in the system to capture that. I don't know if that doesn't really help, but I know that there was just some, scenario driven. So I think we may have to address those specifically after the fact. But I just saw a lot of questions coming in regarding, I provide service at home, but there's also, park, grocery store, different types of areas where service may be provided.
So just as we can look through those scenarios and maybe include them in a future FAQ. But essentially, we want, of course, to promote community engagement with our members and make sure they get support when they're engaged in their community or learning a new task or skill. And so the various, really what boils down to it is what device options are picked by the member and their family. Based upon if they do receive a lot of community-based care, then the smartphone device and application would be the optimal feature, because the caregiver can sign in and sign out from a community-based location and support that engagement. So it's just, we want to allow as much flexibility as possible. In regards to, I think there was also a question regarding the cost of the devices. So going back to the cost, when we talk about access as far as the Sandata system goes, if you use the Sandata, the cost of the devices are including when we talk about we're funding for the development and implementation, the cost of the devices are included in that.
Hi, everyone. This is Danielle Ashlock. Just while there's a lull, I'd like to interject because I'm already getting a lot of questions in the EVV mailbox. I'd like to let you know we do not have the third-party data sharing requirements with Sandata figured out just yet. We're still working on finalizing some details about our system with them. Once we have that figured out, we will be able to release those third-party EVV requirements, so you know what your system has to share to be approved for that third-party system. So if you would like to sign up for our constant contact list on our website, it's www.azaccess.gov/EVV. Under Stay Informed, you'll receive notification as soon as those requirements are released. Thank you.
And as far as this moment goes, if you have questions, please submit them via the Q&A or the email chat as Angel instructed at the beginning of the session. That'll help us make sure that we're capturing the specific comments and feedbacks and questions from this session and be able to log them and categorize them, so that helps inform what additional outreach and tools and information we provide to you in the future.
And I think, Dara and Danielle, I think that's probably going to be the best. I'm seeing just a lot of clarification questions. So I think some folks maybe had missed a little bit of the first, and I think we're getting some more policy-driven questions that, and then some collaboration questions, I think that we'll have to address that's not really demo-driven or system-driven. There is just a recent question potentially. I don't know if you can address this, and I think you did address it earlier on, but there is a question concerning the go live time frame. So there's a question regarding whether or not providers are required to use Sandata on January 1st, 2020.
Sure. So if someone could turn to slide 10, that would be great. We address this in detail in our FAQ document that's posted on our website. The 1/1/20 deadline is a deadline for us at the state level for access. And as we talked about at the beginning of the webinar, that there is an opportunity for states. The federal regulation allows an opportunity for states to apply for a good faith effort exemption of the 1/1/20 deadline. And what that means is that if we are actively actually developing that request to CMS today, currently, and working on that, and plan to submit that by the end of this month. If CMS approves that exemption, what that means is we will be able to implement later in 2020 without the state receiving a penalty, a financial penalty for non-compliance. So we are very confident that we would receive approval, and we are planning to implement within the first half of 2020. Once we develop that request for CMS and we send it to CMS, we are going to post it on our website. And we will also update our timeline, our projected timeline on our website to be more of a very specific timeline and give you outlines of when you can expect different, either different points of information or when you can expect that we are going to need something from you. So the important thing, as Danielle mentioned, is for you to sign up for the constant contact. So when we post that information to our website, you will get it directly from us as soon as we add it to the website.
Great. And Danielle, I know you just said it, but just to reiterate, because we've got a couple follow-on questions, we are working on the specs for the alternate EVV. Again, please sign up for the Access listserv that Danielle explained. I will post the web link in the chat so everyone can follow that to get signed up, so you can stay informed. There was a question that came in regarding pictures of the fixed visit device. Dara, do you want us to talk about, we're working on a little piece to help people with a visual on the different device options. Did you want to speak to that briefly, that, we're going to we're working on more information to help with informed decision-making process?
Sure. As Angel mentioned, we are actively working on, for lack of a better word, a flyer or handout, a one-pager that will list out the different device options and what would be key decisions that or thoughts or questions that members and their families would want to ask themselves as far as helping them determine which preference they would prefer, or which device that they would prefer based upon their lifestyle. There's going to be a wealth of information on there, and so we are actively working on